surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens, and we're taking your calls at 866-870-5752. And right now we are speaking with Tila in Alabama.
Hey, Tila, Dr. Marc Darrow, you still with us?
Absolutely.
Hang with me. I got more to tell you, okay?
Good.
Because I got more questions to ask you and figure this out. You're a great caller, and we appreciate and love you. Thank you so much for calling in. Number one, hang with us, Tila. So, number one, we're talking about how to heal your body without surgery when you have musculoskeletal problems. We use stem cells and platelets to do that. Platelets are little cells in the blood. We just draw your blood, spin it, get rid of the red cells, which are sort of painful when you inject them. And if you put them in a knee, they're going to blow it up, and you're not going to like that. So we take those out, and then we just inject it right then. And the stem cells we can get from bone marrow. There's other ways now to do that. Bone marrow is a very easy way. I used to start, when I first started doing stem cells, I did them from adipose, which is fat, which I don't think is the easiest way to do that for the patient. Easy for me, and when you do a lot of something, it becomes easy. And I do this work all day, every day, endless procedures, and I love it. The more, the merrier. I love this work. I love being in the office. I love watching my patients heal. It is so much fun. So if you want to call the office, the number there is 800-300-9300. That's 800-300-9300. There's people there that can answer your questions. And if you want to watch these procedures, I have a ton of videos on the website, which is www.jointrehab.com. www.jointrehab.com. And there's a spot on every page to email me. I answer emails every day before I go to the office, between patients, and after I get home. I'm usually up to about midnight doing emails, and I love it. I love communicating with people. All my patients get my personal cell number and my personal email address. So I'm very open. I don't like socializing, but I like socializing with my patients. I'm not a party guy, but my office is kind of like my party. So it's interesting. My wife always says, "Why don't you want to go to the party?" And she goes, "Well, you've seen enough people. You've talked to enough people today." And luckily with the work I do, I get to spend time with my patients. It's a lot of fun. We also do something beside the musculoskeletal work. It's called the vampire facelift, where we inject your cells into your face and regrow the collagen there, make you look young. And it can also be done on the top of the head if your hair is thinning. Okay? So very simple things to do, and make people happy is what the name of the game is, right? So I'm going to go back to Tila, who had trigger finger surgery that worked for a while, then it came back. She then had a bunch of injections into all her fingers for trigger fingers. And trigger finger is a situation where the pulleys that hold the tendons in the hand down become fibrotic and inflamed, and then the tendon cannot slip through it, and sometimes there's nodules that form on the tendons, so they get caught. And the typical thing is a hand surgeon will inject that pulley. There's several of them along the course of the fingers, and that shrinks them down and gets rid of the inflammation. The patient has immediate relief, and then they go back to the same activity, and then voila, 4 to 6 months later, they're back in the same boat. What do? They get another steroid shot, another cortisone shot. What does that do? Makes them feel great again for a few months. What happens then? They do that a bunch of times, and then what's the problem? Those tendons can rip. Then you got a real situation, okay? So I'm not a proponent of doing multiple steroid injections anywhere. Cortisone is my least favorite thing to use in the body because of that. and it actually destroys cartilage and joints. So if your doctor's giving you cortisone injections in your joints, not good. Sorry. I wish it were good. It's an easy fix short term, and long term it destroys tissue. So not a great thing to do. So Tila, what I didn't ask you yet is what activities do you do with your hands that cause these trigger fingers?
What initially caused this issue has been I went and worked up at there's a cemetery where my whole family's buried, just almost everybody, and it's just a junk mess. And I decided because my sister was looking at wanting to be buried there, I was going to work on that area where we are so she could be buried there. And it was just such a mess, I started doing the whole cemetery. And
what does doing the cemetery mean? How did you use your hands?
So that means chainsaw, weed eater, pruner, rake, pulling stuff up. Then I had to load stuff on a tarp, drag it about 100 yards. Okay. And that's cutting up trees and everything. So it's expensive work. And I'm just doing it, just me. And so it just, when I'm finished, and it's just, I spent maybe 6 hours the first day I was working on it. And then from there, I just put 2 to 4 hours in when I can. Okay.
So let's get you in the office and try PRP under ultrasound guidance. There's a lot of guys doing it. It's not my specialty, but I'm willing to give it a try with you. And why not, right? I'll use the ultrasound. Really? We can dissect away the pulley from the tendon. With the ultrasound, we can see where that needle goes and squirt a little solution in there and pry it loose. I do a lot of those with carpal tunnel syndrome, and that works well. I just haven't done it with PRP. So
that's interesting. I had that you mentioned that I had both wrists done at the same time in 1994. Okay. And totally was amazing after that. I had worked at a job where I was using my wrist horrifically. Time-sensitive business around holidays, and by the time it was that a steroid shot you had in the carpal tunnel? That was surgery on both.
Surgery on both, yeah. The surgeries usually work pretty well.
It did a beautiful job.
I occasionally get people that have had the surgery where it comes back, and then I can help them. We hydrodissect the nerve away from those tendons in the carpal tunnel, and people get better. And I've done PRP on that, and that's worked great. So I think it'll work on the pulleys in the finger also. And it's very conservative.
I'm sorry, go ahead. I didn't mean to interrupt you.
That's okay. Go for it.
Sometimes it's a little delay and it gets softer. And you're saying something.
I know.
Basically, I can call and talk with them because it would mean a trip there, of course, because I'm in a different part of the country right now.
When you're in town, just let me know. The number to the office is 800-300-9300. Tell them you're a radio guest and that you want to get right in. What I would do if I were you is when you get into town, have an appointment with me the same day in case I need to see you another time if you're only there for a day or two or 3 or 4.
Right. Okay.
Rather than waiting till the last day.
Oh, wait, okay, rather than waiting the last day, gotcha.
Yeah, now there's some other things in the meantime that I want to tell you can do to help your hands.
Okay.
Get a salad bowl that both your hands can fit in, put it under your faucet, and put in the hottest water that you can stand without burning yourself with some Epsom salt, like a half a cup of Epsom salt. That's magnesium. Okay. And magnesium will infiltrate those tendons and help relax them. Okay? And then what you do is you stretch your fingers to extension where you push them backwards, and then you flex them to where the fingernails or the pads of the fingers touch the palm of the hand, very slowly and gently. And you do that for about 10 minutes or so. And if the water starts to cool off, you just turn the faucet on again with the hot water till as hot as you can stand it. And then massage the pads of your hands with your thumb back and forth and loosen up those areas that are, quote, stuck. And if you do this twice a day, every day, you can do your own home version of a trigger finger release.
How about that? Well, I'm definitely...
Now the other part of the equation, though, is if you're doing the same stuff that caused the problem, they're probably going to come back. And if you have the type of job where you have to do things that are repetitive and using the fingers and the hands like that, like you've done, then you're going to have to do these home remedies over and over and over and over to keep yourself in shape. Now,
Yeah,
I've had frozen shoulders, where the arm doesn't lift from injuries,
right.
and I worked those both out. And I've had trigger fingers that I've worked out, and they'll come and go depending on the activities that I have. I have a new doctor in the office named Dr. Thomas Grove, and he's taking over a lot of the injections. And he's only been there a week so far, and my fingers are already feeling better. So
Wow.
you can't hit your head hit yourself in the head with a hammer and not feel it.
Right.
You know what I mean?
That is true. Well, these are things I can work on because I'm very diligent to do my PT exercises now.
Yeah.
And, not making a lot of headway, but it sounds like if I do that with the Epsom salt.
Well, I promise you what I'm telling you to do will help you. I promise
I
you,
believe
it'll help
that.
you.
I believe that, and I think lifelong is what I'll have to do because I'm always going to stay active. I'm 62, and I conceivably could live till I'm 92, but I'm very active, and I need my hands to work. Thank you.
Well, honey, I love your southern drawl, and God bless you. And again, the number to the office, if you want to call in now, is 800-300-9300. And I'm going to say goodbye to you for now, Tila. Call in anytime you want, though. You're
Thank you
wonderful.
for your
You're
Thank
a
you,
very
Tila.
smart woman. You're articulate, and it's fun talking to you. And for the rest of you who want to talk to me live right now, the number to the studio is 866-870-5752. And if you do call in now, I'm going to send you out a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. What does regenerate means? We typically can grow back enough tissue so we regenerate the area, rejuvenate it, and make you feel good again. I don't care if you have shoulder tears, tendon tears, meniscal tears, labral tears, rotator cuff tears. It doesn't matter. I inject anywhere in the body, hamstring tears, arthritis in the toes and the fingers. Anywhere that bothers you, I've probably injected over and over and over for the last 25 years. I've done this on my own body. I am a sports addictive person. I love repetitive things. I've had periods where I wanted to get a certain golf shot done and learn it. I remember being in the sand and in the sand trap, hitting one shot for 4 hours till I got it down. And that wears the body down. And when I do wear myself down in a certain area or injure myself, guess what I do? I inject myself and heal it up. So I've injected both my knees with platelets and stem cells, my elbows, my shoulders, what else? My wrist. I know I'm missing some things. I've had other friends do my neck and back, which I've injured many times over the years. And I'm very lucky to be in this profession of regenerative medicine because I'm the guy that needs it the most. I probably have had more injections in my body than any other person alive because I have access to it. So instead of suffering with an injury or other things, overuse syndromes, I'll just inject it and heal it up. So I'm an experimenter. I try everything on the market, and I have reps all the time. I had a rep in the office yesterday who sells exosomes, and they're going to give me a solution of that to try. And I like to experiment. When I heal with something that I don't know about, then I ask my patients if they want to try. And that's how I got into this line of work as a doctor. I had been healed with pro-low therapy. My wrist was my first thing, and it healed 50% overnight. It woke me up that surgery or cortisone is not the answer, at least for me. And then later, I did my shoulder. That healed 100% overnight after a failed shoulder surgery when I was in medical school. And that woke me up really a lot. Then I started asking my patients, can I try this on them? And everybody said yes, because nobody wanted surgery. And then it became what I do for a living. I think I've done more than anybody on the planet, on my body and on patients. When I'm at national meetings, people come up to me, because I'm pretty well known in the field, and they go, how do you do so much in one day? They say, I usually do about what you do in one day, I do in a month. So LA is a good place to be. It's a big population, and there's a lot of injuries and a lot of arthritis here, so I get a lot of practice. All right, Nita, should I go to a question, or you have something to add?
Just wanted to mention the free book we still have time for people to call and get their free copy of your latest, which is Stem Cell and Platelet Therapy, Regenerate, Tone, Upgrade.
All right. I'm going to go to another question here. And the questions come in through my website, www.
Keep it short because we're getting a call.
Well, getting a call or got a call?
Well, we'll see.
Okay.
Okay. Unless you want to do a joke.
No, I was actually going to say something that you cut me off on.
Oh, I apologize.
You hurt my feelings.
Oh.
I'm kidding you, Nita.
Should I send you some C's candy later?
That'll work.
Okay.
I actually had a piece yesterday.
Or do you want to talk to Trevor?
Trevor, Dr. Marc Darrow, how are you today? You've got low back pain.
How you doing, doctor? Yeah, good morning. No, well, actually...
I'm living it up.
Yeah,
how long has your back bothered you for?
I got some PRP injections with you about 3 weeks ago.
Oh, okay.
Yeah, and I feel a lot better, man, believe it or not. But I wanted to ask
Wow, that's fast.
I'll probably start doing this maybe like every 6 months for maintenance or, once a year. But is there anything...
Well, let's hope you don't need to. The goal is to do it and fix it.
Yeah. Well, what about like acupuncture, just like in the in-between and stuff like that? I mean,
you can do acupuncture. I mean, look, you're setting yourself up for something when you say, I'm going to come in at this period or that period. Don't even think like that. Think of getting it fixed. Yeah. So you were there 3 weeks ago, you said. And
about 3 weeks ago, yeah. I mean, I can't walk, man. And I was having a lot of issues that went in there. I think I was there about 2 years ago prior. Okay. And, I feel a lot better, man. I think the first week
What do you do that irritates your low back? What activity do you do that causes it?
Yeah, but so that I just wanted to ask you, man, because I know they said maybe do some acupuncture in between or something like that. But I wanted to see if you recommend that. Like, I don't want to miss up my injections. You know what I mean?
You won't mess anything up. My job is to grow tissue. Acupuncture is to get rid of the pain, and they're different. They're totally different in what the goal is. My goal is to get you fixed. So to get you fixed, are you still having pain after that injection 3 weeks ago?
You know what? Just the first week I was. And
the first week you're supposed to.
Yeah. No, exactly. I mean, and then it calmed down, so this is, man, I think I might even go to a party tonight, man, to tell you the truth,
Well, are you going to dance? Are you going to dance? Are you going to do the boogaloo?
Yeah. I won't take it that far yet, but yeah, I mean, at least I'll get out there. You know what I mean?
So your back is feeling okay now?
It's feeling better now, yeah. Thank you.
Terrific,
and,
terrific.
Like I said, I just wanted to do some other maintenance, like in the in-between, So,
okay.
I mean,
well, for the in-between, I'd like to see you again and examine it and touch it and see what's going on. And I'd like to actually get you in the office this week to do it.
Yeah, well, I have an appointment on, I think, the end of the month, so, we'll see.
Okay.
And, but I just wanted to just, like I said, I got the vitamins and stuff, and just wanted to see what else you recommend. But all right.
No, Trevor, just take care of yourself. It sounds like you had a good treatment, and you're doing well. And I'm grateful you called in and let people know how this stuff works.
I'm not. Yeah. So no, I appreciate that. I appreciate the help, man.
All right.
Instead of going to, I think my doctor wanted to do cortisone, so epidural.
No, stay away from that.
Yeah, I thought I was having a baby. He wanted to give me an epidural, So glad I went that way, man. The PRP.
All right.
So,
well, I'm glad you did too, Trevor. God bless you. I'm glad the PRP worked on your back. You have a great week, and I'll see you when you come back.
Appreciate it.
Thank you.
So our number is
866-870-5752. I'm going to go to a quick question here.
Okay.
I have to say a quick question or Nita will cut me off again.
No, I won't, because there's no caller right now, but there will be.
Okay, so this one says, Mom's knee pain. Let's see what the question is. My mom is 90 years old and still active. That's cool. I hope I'm like that too. She has had some knee pain and x-ray was taken. They discovered that she has bone on bone. Does your practice deal with this issue? Yes, all day, every day. We treat people that have bone on bone. And it's a funny question because I rarely ever get someone that has bone on bone because that means the joint's not going to move. But I do get people all day long who say their doctor said it's bone on bone. What does bone on bone mean? It means you need a surgery. Does it mean you really need a surgery? Nope. Every single day, somebody's going to come in, go, I've got bone on bone, I'm told I need surgery. None of those people have had surgeries because we fix them. How do we fix them? We grow back the tissue. Is this sinking into you guys? I'm not putting down surgeons. That is their culture. Their culture is to operate when there's a problem. My culture is different. My culture is to heal, not to operate. Operations don't heal. They cut tissue out. Sometimes it's just stitching stuff back together, which I think is a great idea. But the studies over and over and over show something like if you have a meniscal tear in your knee, 6 months down the road, you're going to be the same if you had a surgery or you didn't. Why take the risks of a surgery? I get people in all the time who get worse, who get infected, all kinds of negative things that happen. We call them sequelae when you have a surgery. It's not the best thing to do first. If you try everything else out there and you still think you want it, God bless you, go do it. Most of my patients don't end up getting surgery. Some do, but in my opinion, they never should have anyway. They just didn't do enough treatment. What are the failures of regenerative medicine using peer stem cells? People being too active afterwards. So if your pain comes because you're super active and you get these treatments, you get better and you're super active again, what do you think is going to happen? You've got to give it a chance to heal. Another reason for failure is taking things like ibuprofen, anti-inflammatory, steroid shots, cortisone. It ruins the tissue. It blocks the cartilage from regrowing. Okay? And I think, the biggest reason for failure is what I call bad doc. It's when you go to a chiropractor, let's say, and they get a dinner together and they have someone come out who talks about it, who doesn't even know what they are doing, and they'll line people up to get injected. Not good. You need someone in any form of medicine that you need to pick the doctor who does the most. That's with surgery, too. When people say, I'm adamant about getting a surgery, I will tell them the doctors who do the most of what they need. Someone who has the longest and most experience. And then a final reason for failure with regenerative medicine is not using an ultrasound when it is needed. You've got to look inside the body so you can see where that needle goes if it's one of those spots that needs that. There are some spots in the body where you don't need an ultrasound, and there are spots that do need the ultrasound. Nita, you breathed. What's up?
I just wanted to make sure you talked about the book one last time.
Free book. I'll mail it out for free, no postage, no nothing for you. It's called Stem Cell and Platelet Therapy. Regenerate, don't operate. What's the catch? Call me up. 866-870-5752. Nita, would you let me take another question?
Sure. I'll let you do whatever you want to do.
I love it.
You're the boss.
Nah.
Yeah.
Nah. All right, this one says foot, ankle, and back pain. Uh-oh, this person's got problems. So they had a fall. End of the show. God bless you all. Thank you for listening, Nita. God bless you. Suzette, Alex, and the crew, God bless you. If you want to reach me at the office, the number is 800-300-9300. Go to the website. You can email me, www.jointrehab.com. Thank you all.
And listen to our pal Warren Eckstein, 11 to 1 every Saturday. We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain-Free with Dr. Marc Darrow is heard Saturdays at 10 a.m. and 1 p.m. and Sundays at 5 p.m. here on AM 870, The Answer. Remember, to take the first step toward a pain-free life. Call to schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.